Now for a reaction on Minister Motsoaledi's report as well as earlier media briefing, let's extend a very warm welcome to Advocate Stefanie Fick, who is the Executive Director of the Accountability Division at OUTA. As Advocate, as always, great having you with us. A very good afternoon to you. So let's get your initial reaction to the Health Minister's briefing early today. My eyes were popping at some of the revelations because you have to ask yourself, I mean, how could such lack of oversight continue seemingly unabated for the number of years that is being reported? I have absolutely no words.
Amasa, I agree with you wholeheartedly. The numbers that we are seeing, I mean, you're talking about billions. It's I don't think we realize how much money that is. And then I immediately think, you know, how much money, what we could have done with that amount of money. But be that as it may, you know, it's good that the SIU has made it in trying to curb this types of maladministration. But yes, I also agree with you. Although this is now investigations that was done, what are we going to do and try and stop this type of behavior? So what is the preventative measures we are going to start taking?
Especially on that note, Stephanie, on preventative measures. I mean, now the health minister went at great lengths in explaining their findings, and judging by what was revealed, we hope that more heads are definitely still to roll. But the fact that it was actually state officials that were the enablers and colluders in some of these cases should make all of us hang our heads in shame. So in identifying the fact that the problem actually starts with some of these greedy officials in these very key sectors is actually quite disgusting. Reports of bribery of such officials, be it in the police, at the ports of entry, at borders, at home affairs or health, just to mention a few. How can we change the system or way in which they're actually vetted or hired in their positions with contractual obligations that will obviously ensure that they know if they are caught in any corrupt activities, then serious repercussions will follow? I mean, can we do that, and how?
No, I'm convinced we can do that. You know what? Maybe we should start. And what you have said rings. There's so much truth in what you said. Maybe they should hire you. That might be a good start. You know, taking charge of what is wrong in the department. It is mind blowing to understand the amount of money that is lost in corruption, maladministration, etc. And I think it is about. I think let's start. I think there must be a political will in order to change these departments. And then there must be a will to hold people to account. In other words, consequence management. People should understand that if they are caught, that there will be consequences. I mean, you've just shown, you know, the memorial with Babita Dukurin. Yes, the guys that were involved in her killing were sentenced. But what about the people in the department? How many have we seen that was, you know, prosecuted and sentenced if they are found guilty? So it's that type of willingness to make sure that departments are cleaned of people that are willing to sell people's medical record. We've heard what the Minister Motsoaledi said. People are willing to sell medical records so that, you know, we get these types of claims. So I really think that, you know, the fish rots from its head. So we need to look at management. We need to look at the will to hold people to account, and even political leaders to hold them to account. I mean, if you just think about health, what happened to our previous health minister? Any movement there?
Absolutely concerning, Stephanie, because then the direct impact of these fraudulent claims is the fact that the vital healthcare products like your medicine and operations for those who were severely in need and rely solely on these services were actually either sidelined, others might have even lost their lives because of the impact on the overall budget. But then how do we ever address this behavior? I hear you saying there needs to be consequent management, but on whose side, on whose part, and who's supposed to be then at the end be effecting all these changes?
I think it's a multi-pronged approach. I don't think it's only just management in, for example, the health in the health department. You also need to look at the NPA in their ability to prosecute. I mean, we've seen how they've struggled a bit with state capture. Daily, there's other crimes that happen. That doesn't stop. You know, the criminals in this country doesn't stop because the NPA has got a problem. And then law enforcement. I also think that more visible policing is important. So it is a multi-pronged approach. Appointment of people, making sure that the right people are in the positions that will take charge. Preventative measures. What are we going to do in order to make sure that we don't get these types of, claims? What more can we do? I mean, I was quite flabbergasted at the fact that we are still working with, paper records. Isn't it time that the department, with probably a budget around 233 billion rand a year, that are, surely there's preventative measures we can do. And I agree with you wholeheartedly. It is the department's ability to look after everyone's health. I don't want to open another can of worms, but we are so stuck on this NHI and that the private sector money that's available is going to save, the public medical services. But, before we go there, we need to fix the current services that are available, for the people. Clinics, making sure that they get the money that is supposed to go there. Again, it is about the income and how we deal with the expenses and making sure that people that are in charge of the expenses are the people that's going to do this job, that are doing it because they want to do it in the best interest of South Africa. Now, this may sound all lovely. How are we practically going to do this? And again, I say, it is about management. It is about, it starts with the minister clamping down on this type of things, working with the SIU, which is good, I must say. Kudos to Advocate Motsoaledi and his team that can do these type of things. But it is clamping down and making sure that we have the right people in positions, the right heads of hospitals, so that they can appoint also the right people and all the way down. And maybe lastly, is to also create an environment where, and we're talking about health, but I think it's in all departments, looking at salaries. We have a salary bill in South Africa that's quite high, but I sometimes think that the salaries are going to the wrong people. We have a bloated cabinet. Use some of that money to make it possible for individuals to, work as nurses, work as teachers, enable them to make a living by doing these jobs, which is really a service to the people.
Absolutely, Stephanie. And in closing, we understand that, of course, according to the minister's earlier media briefing, more investigations are still continuing. So we are hoping to see some imminent arrests very soon. So will OUTA be joining this fight to ensure that accountability is realized?
Oh, that is what we stand for. So what I can also say is maybe a shout out to the whistleblowers out there, that if you do have evidence, if you do have documents, there's many ways that we can, do this without putting people's lives at risk, and that we do need the brave individuals. And let's celebrate all the whistleblowers that were brave enough, and that there were dire consequences for them. Babita Dukaran and her family, give us the information so that we can do that. We are also not the only organization, but please, it is for brave individuals to stand up, point out the rot so that we can start making changes. And the private sector has also got an enormous task in order to make sure that we bring an end to corruption in general.
All right, Stephanie, thank you so much for your contribution this afternoon there. That is Advocate Stefanie Fick, Executive Director at OUTA.